Can vitamin D supplements really lower your risk of a heart attack? Here is the study that's getting a lot of attention. It's known as the Target D trial, and the study title is Heart Attack Risk Halved in Adults with Heart Disease Taking Tailored Vitamin D Doses. But before you go out and buy vitamin D supplements, there are some things to know about this study. So let's take a look at that now. So the investigation involves 630 people who've already had a heart attack who have heart disease. About 80% of these people are men, they're in their early 60s, and about half of them have already had a heart attack. These people are split into two groups. One group gets a tailored amount of vitamin D to keep them in the range of at least 40 nanograms per milliliter, but no more than 80 nanograms per milliliter, and the other group does not get vitamin D supplements. All these people are then followed for 5 years to see what happens. And here's the key finding that got everyone's attention. Those people whose blood levels of vitamin D were greater than 40 nanograms per milliliter had about a 52% lower risk of a heart attack compared to those people who did not receive vitamin D supplements. Now, before you run out and buy vitamin D supplements, there are some things to know. Number one, the only people involved in this study were those who were diagnosed with heart disease. In other words, this study does not prove that taking vitamin D supplements lowers the risk of heart disease or heart attacks in people who are healthy. Something else, about 80% of the participants in this study were men, and over 90% of them were white. In other words, this study doesn't prove that vitamin D supplements will lower the risk of heart attacks or heart disease in women or people with darker skin. Also, for all the fanfare this study has received, understand that this study was presented at a scientific conference of the American Heart Association. In other words, it does not yet appear to have gone through the peer review process. Also, keep in mind that these people received a tailored amount of vitamin D every 3 months. It was either increased or decreased based on what their blood levels were. That's very different than going to the store and getting a vitamin D supplement, which is going to contain a fixed amount. For example, 5,000 international units or say 125 micrograms. What I'm getting at here is it's probably a good idea to go and get your blood levels tested to see if you are indeed deficient before you just run out and buy a vitamin D supplement.